Ever wish a podcast would explain how to get better faster from the standpoint of longevity, biohacking, and personalized functional medicine? Co-hosts Dr. Jason Bradley and James Chester, along with executive producer Rachel Bradley, bring you the Get Better Faster podcast. Their mission is radically simple: to revolutionize health by connecting people with the experts, technologies, and protocols that mainstream medicine ignores. Because people deserve to get better faster.
Hello, Get Better Faster Nation. I'm Dr. Jason Bradley, and along with my co-host, the one and the only James Chester, and our incredible executive producer, Rachel Bradley, we want to welcome you to another exciting episode of the Get Better Faster podcast. Today, we're joined by someone who's literally rewriting the book on how we understand the body's intelligence and its ability to heal itself. Dr. Dylan Miller is a chiropractic physician who serves on the executive board of the International College of Applied Kinesiology, an organization with chapters in more than 14 countries worldwide. He's authored 8 groundbreaking research papers, won multiple professional honors, including the Alan Beardall Memorial Award for Innovation, and he's pioneering work that combines diagnostic muscle testing with functional neurology to uncover root causes that traditional medicine often misses entirely. But what really sets Dr. Miller apart is his mission: helping people reconnect with their body's own communication system and showing them that real healing is possible when faith, science, and the nervous system work together. If you've been told it's all in your head, or you've exhausted every conventional option without answers, this conversation is going to open your eyes to possibilities that you didn't know existed. Without further ado, Dr. Miller, welcome to the show.
Hey, thank you guys, and I appreciate the opportunity.
Yeah, it's really cool. As you know, Dr. Jason Bradley's chiropractor, functional medicine doctor, and I am chiropractic advocate, podcast guy. But it's really cool to have a chiropractor on our show because us interviewing all of the amazing people out there that are getting people better faster, we're actually creating a new constellation in the sky where we're going to align all these amazing practitioners from around the world that are going to be really giving people ideas on how they can heal their bodies without the big pill mills and the medical mafia out there. So take us to that moment, Dr. Miller, when you discovered that the body has its own innate intelligence to communicate through muscle testing. What was the aha moment for you that set you out on your path? And when did you know that you had something that could get people better faster? Well,
I would say, I don't know if there was one moment that I got set on that path. It's been a journey, and it's like, it's a marathon. I'm always amazed at what the Lord put in place to let us heal like that. And I really don't know that there was one set instance, but what set me on this path was, I grew up on a farm, and I was graduating from a D2 college with an ag business degree, trying to figure out what I was going to do with my life. And I got in a car accident. And for the first time in my life, I was, safe, thank goodness. But my ribs just hurt and finally had to go to the chiropractor. And that chiropractor actually did some muscle testing. And I just found that fascinating. And that kind of opened the door to me researching chiropractic a little bit, because I knew I was going to have to pick a direction in life here soon. It just is probably 2 semesters before I graduated from the undergrad. And one thing led to another, and chiropractic has kind of opened doors, and I started down that path. And I knew that I didn't have any experience and didn't have any expectations for what chiropractic was capable of. And that was a blessing, but in the long run, it was a blessing, I should say. At first, it's just, I don't know what to do with this and where I'm supposed to go. But I said, I'm going to not rule anything out, even the kind of off the beaten path stuff. And that's what led me to this muscle testing. And guess what? That started answering questions I had, and it started opening doors. And again, it's just like the cream rises to the top. In this applied kinesiology world, it had the answers to all the questions that I had, and it still continues to answer questions as our community shares with one another. And that's what's so great about it, is everybody they come together a couple times a year. We have a big conference and they share, and then we all learn, and guess what? Patients get better and better and better from that. And that's what it's all about.
Well, it really brings it full circle for me and Dr. Jason, because we have deep-rooted philosophy, and that's one of the main emphasis of what we do together here on Get Better Faster is we wanted to instill the chiropractic philosophy into all these other amazing healers from different walks of life. And that's a big emphasis for what we're doing. Is a lot of people think that they're doing the right things when they are, but their scope lacks philosophy. And as you know, the body needs nothing extra in it. It simply needs no interference. So when you can find it and clear it and get the nervous system function to where it's supposed to be optimally, the body has a self-regulating, self-healing system inside of it that you don't need a pill, a potion, or a lotion to turn that on or off. The innate intelligence is alive in everybody's bodies. We just need to be able to let it flow the way it's supposed to. Dr. Jason, I know you want to jump in.
No, I think thank you for nailing that down. I mean, it's fascinating when we start talking about that innate intelligence and how every cell in our body, our DNA, is coded to be healthy. I mean, ultimately it's coded to be healthy. And I love that idea of it doesn't need interference. It just doesn't need interference. That's the biggest thing that we can provide. But I have a question going back to Dr. Miller and really jumping into diagnostic muscle testing. Can you, just for our listeners that have no idea what the heck we're talking about, can you explain diagnostic muscle testing that in a way that helps our listeners understand what it actually reveals about the nervous system and how this gives you like a functional window into how the body's operating in a way that labs might not be able to pick up?
Sure. And I think just to start off with, to lay that groundwork, the Color Atlas of Physiology, it literally says, with few exceptions, all activities of the central nervous system, receiving, processing, and integrating information ultimately find expression in the contraction of a muscle. So with that being said, the diagnostic muscle testing, I believe, is such a missing link that professions across the board are missing out on, because if you can use the nervous system to let it tell you what it wants, it takes a lot of the guesswork out. So what you're doing here is you're using the functional muscle test to evaluate the nervous system and let that person's nervous system tell you what it wants. So you have a facilitated muscle, you could call that a strong muscle. You have an inhibited muscle, you could call that a weak muscle. Those strengths and weaknesses, the nervous system literally adapts and changes even while patients are on the table. So if you challenge the nervous system, let's say I pound on the bottom of the foot and that weakens a muscle in the body, that doesn't tell us a lot of information besides whenever we pound on the foot, there's a weakness in the body. But you compile all of your knowledge together and you can assess many different things that way. But let's say we do pound on the bottom of the foot and it weakens you. There might be what the chiropractic world would call a subluxation in the foot. There's some kind of an issue that the foot isn't congruent with the nervous system. So you can just go through and evaluate many different things like that. And again, the muscle test is just one more tool you add to your bag. It's not an end-all thing. You add that to your bag of tools. That's one thing I want people to understand. It's not just an end-all thing, the muscle test, but it's one more tool that we have to help get the patients better and let their nervous system speak to us. Does that answer your question, Dr. Jason?
It does. Yes, it does. What I wonder is, like, in a real practical way, I like the idea of strong muscles and weak muscles. And I'll try to distill this, and James, feel free to jump into. James is great at distilling things down. What I got, and I should also say that, I just want to clarify too, my first, doctorate degree is in chiropractic, and I learned nothing about what we're talking about in chiropractic school at all. So this is postdoctoral work that you've done in your training, and it's highly specialized. So I just want to say that this is all new material for me as well, to a certain extent. That said, what I got was there's, strong muscles and weak muscles. And you can use those muscles to kind of, I don't want to say test, but to understand how the underlying nervous system and or organs or tissues are functioning. I have a part two to that question, but did I nail that? Is that a good way to say that?
That's reasonable.
Okay.
I'll try to add to it as well whenever you're done, but go ahead.
Yeah. So I was going to say, if we have strong and weak muscles, I guess, can you just walk us through what does it look like somebody coming in, and you're doing your muscle testing assessment? What does that look like? Walk us through. Obviously we can't demonstrate it, but just kind of guide us through what that looks like.
Sure. So muscle testing is becoming more popular. I'll say that, which is a good thing, as people get to evaluate this, but it's not all created equal. There's just a simple muscle test, but then there's the whole neurology. And I always tell patients, you have to get the basics working right. And that's one thing I really appreciated in Dr. Jason's book. He talks about the basics in the, Epic 5 book that he wrote. And, it's really, basics are always fundamental. It doesn't matter what you're doing.
Thank you.
Yeah, you're welcome. Thank you.
Epic 5 plan on Amazon. Shameless self-promotion there. No, thank you, Dr. Miller. I appreciate that. I've got one more person read it. I love it.
Absolutely. And so going back to those basic functions, you got to be able to trust what the nervous system's telling you. And I always tell patients, we got to get these basic things working right before I start just jumping in and muscle testing a bunch of nutrition. And, like I said, the nutritional response testing, that's when I hear a lot of people talking about. And many times, again, I'm glad people are using that, but there's more to the nervous system than this jumping in and testing a bunch of nutrition. And so I tell people, how could this muscle here, if you're pushing on the arm, how could that tell you anything about the foot, like we were talking about earlier? Well, the whole body responds. If you step on a nail, the whole body reacts. You get that whole reflexive response. Even the arms move, even this arm moved. So if you bring the brain's attention to an area that is like a tack or a nail to the nervous system, these muscles will change and respond. So with that being said, another thing I like to explain and tell people is your brain works a lot like a computer. There's lots and lots of stuff going on in the background. But if we can bring the nervous system's attention to one area of the body, it's like bringing that Word document up on the front of the screen. Instead of just hanging out in the background, it's pulled up on the screen and now you can work on it. So I think that's an important differentiation between just straight up muscle testing and actually getting into the function of the nervous system. Go ahead, ask me something else there.
Yeah, but that's where I want to jump in quick, because everything you're saying here, Dr. Miller, it sounds like it's not muscle testing. It sounds like it's nervous system testing. And it sounds like muscle testing is kind of the way that the general public understands what you do. But really, if you take it into like a clinical perspective, you're actually nervous system testing, right?
Absolutely. And there's where the functional neurology part comes in, I think there's another kind of important tidbit. So again, our colleagues are always trying to share and further research, because it is a little off the beaten path and it should be more mainstream, but people need to understand it better. So I believe it was last year, 2024 in Medical Hypothesis Journal. One of my colleagues, Dr. Michael Allen, and he published a new paper, and he kind of explained it as your brain depends on what your body feels first. So what we put in depends on what you get back in return to this muscle test. So your nerves start the message from your skin, your muscles, joints, and those messages tell your brain what to do next. Instead of your brain being the boss that starts everything, your body's sensors are like the scouts that tell your brain what's really going on, and then your brain just responds to that. So input changes the output. It's not as simple as what people like to think of it as. I don't know, does that help explain that a little better? Or is that complicated?
No, it doesn't. I think when you talk about like journals and research, I think it's all valid. I think people need to find that stuff. But I'm thinking I'm the guy on the show that talks like, if we're talking to mom and pop and somebody's like dealing with like a herniated disc in the low back and they have radiculopathy, which is numbness and tingling going down in one of their limbs, probably a leg if it's low back. And just say that they've been to a neurologist and the neurologist has looked at their nervous system and says everything's fine. What are you seeing that conventional neurology might be missing when it comes to the specialty that you do?
That's a good question. And again, I'm able to evaluate and pick apart these basic functions of the nervous system, because I believe that many people are treating compensations, and it's not necessarily their fault. I think they're evaluating what they truly do find then, but the nervous system is confused. So if you can get these the basics working right. So for instance, pain is such a confusing thing to the nervous system. So we need to dampen the effects of pain on the nervous system so the body can clearly perceive what you need to do next. Because again, like maybe you said the leg, and pain down the leg, maybe that actually causes the muscles to contract, and you have a short leg on one side and you have a long leg on the other side. But what if that's truly that truly isn't what needs adjusted, because you dampen that effect of the pain and all of a sudden the legs switch again. You see what I mean? Like the nervous system is confused by that pain. So as you evaluate the nervous system in a way that you can unwind some of these basic functions, the adjusting that you need to do, the changes, it literally changes as you get those basics working right. I don't know if I'm doing a good job of conveying.
No, but as you know, like the body doesn't have to be in pain for there to be the muscle imbalance. As people that are listening, they probably don't know this, but only 10% of the nervous system actually emits pain signals. So what you're doing is you're basically able to be an investigator of where these patterns are before that pain cycle starts to create the compensatory effect of tightening and twisting and contortion that most people just think is natural or normal. But like I'm saying, like there's a lot of people out there that you talked about toolkits. And if a chiropractor has this in their toolkit, it's really, really important for them to have, functional neurology and applied kinesiology and muscle testing in their toolkit. I'm talking about the other people that are diagnosing and saying that this is what you are representing, and that's their conventional neurological thing. And they go after people with, some type of muscle relaxer, or they'll go after people with some type of an injection, say it's a cortisone, like we have to get the thing to calm down. So we're going to shoot some cortisone in your joint space. When then you can come in and do the muscle testing aspect and be like, that's actually not what we need to do. What we need to do is we need to test you where your imbalances are and start getting you adjusted to where your body rebalances and comes back into their languaging, which is called homeostasis. So I think there's a lot to what you said, but I think there's a lot to what I'm, suggesting is where there's misses and where people might think what you do is woo woo. And when all we really want to see is people get better faster, right? Mm-hmm. And I'm going to pass it back over to Dr. Jason because he put his hand up there.
Yeah, no, I appreciate that. And I don't know why this came to mind, but I was just thinking about conventional diagnoses. And again, I want to be clear, I don't like diagnoses at all. I think it puts people in boxes and really limits our thinking about, the root causes and whatnot. But we're just going to play around with this idea of a migraine for a minute. Because I think migraines are interesting. As a functional medicine doctor, I get a lot of people that come to me and come to Dr. Rachel and myself for help with things like migraines. And they've explored, quote, everything. And just to kind of say, what James said, and to add flavor to it, certainly they've gone to their conventional doctor and they've tried painkillers and those don't work, hopefully not opioids anymore. Right. But I know those are still prescribed. They've tried steroid injections. They've tried Botox injections. They've seen chiropractors, PTs, OTs, they're doing everything and they're still having these, what, again, we're just going to classically call as migraines. And, we know from our doctor's training, Dr. Dillon, that migraines or headaches could be vascular, they could be neurological, they could be hormonal, they could be, a deficiency of, fill in the blank nutrient, it could be an excess nutrient, it could be dehydration. There's so many things that a migraine could be. But back to James's point, from a conventional medicine point of view, it's all focused on that pain. It's all focused on, and that's what everybody wants is pain reduction. I get that. But ultimately it's using some drug. Usually, I don't know any doctors treating conventional doctors treating pain that aren't, using some type of pharmacopoeia. But I mean, they're prescribing, they're injecting, they're doing all this stuff. When the reality is, there is or are at least one or more root causes to that migraine. And what I love about the neurological testing, I'm going to try to refer to it as that instead of muscle testing. What I love about this functional neurological testing is that we don't need to run $3,500 or whatever. I don't know how much MRIs are these days, or CTs, or have all that radiology, or inject dyes, or do all this stuff. From what I'm understanding, we could take that category, that big box of migraines, and then you could do some functional neurological testing, muscle testing, and really get to the root of if it's vascular or hormonal or dehydration or whatever that, structural. I mean, it still could be structural, and really pinpoint those root causes, or that root cause for that patient that's in front of you in a really quick, I don't know how quick, but I mean, not over weeks and weeks of diagnostic testing and labs and everything. You can get to it right there. James, I saw your hand go up, but I want to get that over to Dr. Miller.
Well, I'm going to jump in and just say it's always least invasive first. And if we can get somebody with less timeline to get correction for whatever their ailment may be, from hangnails to stub toes to, tennis elbow, if we can help get people to a point where they're actually improving without doing the big box medicine style diagnostics and the pokes and prods and all that stuff. Like, nobody wants to do that. And I think that's where Dr. Jason was going with this for you, Dr. Miller, is nobody wants to do that. So it sounds like that there's some more efficient ways to test and to get results without the whole merry-go-round of the medical field.
Yeah, and that touches on a great point. It's just so frustrating that the paradigm's starting to shift, but it's been so medically oriented that that's the first thing people jump to. And it's like, well, before you go and worry about all the crazy expensive testing and this and that, how about, again, we just focus on some of these fundamental basics. Let your body do what it was designed to do, and heal. And the food sources are a big deal. If you have food allergies that drive those migraine headaches, and then there's the neurology part of it, of course, that your nervous system is dealing with. But it's always comes back to these basics. You get these fundamental basic things working right, then everything gets so much simpler, and you can usually correct 90% of these things just by getting the basics working right. Then you can pick up the pieces that are left over. But everybody has been trained to just jump straight to medication and straight to, oh boy, like I have a headache, let's rule out some horrible thing that's going on. Well, the first step should be go get evaluated and do some basic, healthy things, and give the body a chance to even heal itself to begin with, but usually people put these things off for so long, and then they finally decide to go, and the first place they go is the medicine route. And, that's just completely backwards.
It's totally true. I mean, I'll jump in real fast. I agree with you. I mean, I think we've been conditioned. This is going to be a Bradleyism opinion here. I think that we've been conditioned as a society to go to aggressive medicine first. And I'm just looking at Jan. I don't know if you guys saw in the comments, but Jan's, said she's paralyzed, so to speak, for the moment. Feels like there's a vice grip. Sometimes it looks like her legs lock up, and if it moves, it intensifies. And then this is where it hit me in her comment that she said she's had 3 back surgeries, and then doctors say it's just nerve pain. Here's a cream for it. That helps a lot of the time. But she wanted to know if muscle testing could help that. I'm going to let you answer that, Dr. Miller. But I just want to say too, that when she said I've had 3 back surgeries, I don't know many people that have 1 back surgery. And there's many reasons for this. And I think that, we throw these things out at people like, oh, you've got a disc and we can do this, or you've got the foramen, the opening where the nerve comes out. It's, it's degenerated, and we have a nerve pinch. And so let's just go in there and do a foraminal block with an injection or epidural block, and we can put rods in there and we can stabilize, and all these things that these surgeons say, and people, hopefully feel better. But what they're not telling people is that the body is going to put scar tissue around all of that work. That scar tissue is going to continue to grow. And roughly every 5 to 10 years, there's probably going to, doesn't there have to be another surgery, but that's about the life cycle. But every 5 to 10 years, 15 maybe, people are going back in for another back surgery because that scar tissue is building and building and then compressing on that nerve. So it's two point question here from Jan. I'm not sure if this was her question, but I'm going to ask it for her. Her first one was, could muscle testing help her clarify why her legs, her low back all lock up, hopefully not at the same time, and lead to this paralysis? Secondly, someone with 3 back surgeries, we don't want a 4th one. Can muscle testing help her to help that body not have to have that 4th or 5th or 6th surgery? Dr. Miller. So
obviously, once you've had a surgery, it does complicate things a little bit because there is the scar tissue and I don't know, did she have rods put in? Was that, or do you know that?
I don't know.
Well, the surgeries, there's 3 things that can happen. You can get better, you can get worse, or you can stay the same. They don't tell you that whenever you go in for surgery. They just say, we can probably help you. But that's a big deal. Not many things I do should make a patient worse. We try to do these natural, safe, most conservative things you can first. However, if you've had a surgery and you're dealing with that, you can still get help. So I started to kind of touch on this with those pain reactions. They're so important to the nervous system. And by doing this diagnostic muscle testing, what's interesting, many people don't understand, and that's kind of why I said that earlier, like what you put in changes how the brain responds. So whenever you stimulate that pain and you activate it, or let's say we even just have her put a hand over her low back, if that's where she had the surgery in her back, let's say, bringing that to the front of the brain's and nervous system's attention changes how the body's going to respond and then how the muscle responds. So whenever we're testing, if you can bring that to the front of the nervous system's attention, you can help clear out some of these neurologic responses that are ingrained really deep into the nervous system. Again, it's like that Word document. It's hanging out in the back of the computer screen, but if you pull it up to the front of the screen, the brain recognizes it in a different way. Then you can help change even those old injuries and old surgeries and things like that. You can literally help unwind how the nervous system perceives the rest of the body, and you can actually truly change how things are. It's amazing.
I have one statement and then one question. I'm going to ask a question on Jan's behalf. The statement is, I've always believed that the chiropractic profession should be port of entry for anybody that's dealing with anything when it comes to, as the more evidence-based approaches, musculoskeletal approach, the things that people are dealing with for muscle and skeleton issues. I always believe that chiropractic first because it's least invasive and it doesn't do the cut it out, drug it out, burn it out methods. And I think that everybody should understand that chiropractor should be your first go-to practitioner for diagnostic testing, the exam, the consultation, the health history, the neuro, the orthopedic, the muscle testing, those types of approaches with x-ray to get a proper report to see if something can be done without more invasive, medical procedures going on. And like I said earlier, if we can take this as a least invasive first approach, then people get better faster. And who doesn't want that? Merry Christmas, right? But I know this is a question for Jan and other people that will be listening to this in the future, or maybe they're listening today. If people are out there and say, this sounds amazing, I want this. How do people go about finding a qualified practitioner to do this type of diagnostic testing for them to where they might save their neighbor or their friend from further complications or get them out of the mess that they're already in?
Sure. So there's a website. It's the ICAKUSA.com, and they have a Find a Doctor that will only take you to active members that are, in part of that membership. And, people are free to contact me, and I'm help them find anybody anywhere in the world if they want to. But that's where I would go, is to find a doctor on the ICAKUSA website.
Well, that's just my earnest approach to being, host of the show. Is I'm an action guy. I want people to find solutions, and I want them to have somebody that is a trusted resource for them. And that's why we feature very credible docs and people out there that are working in their methods to get people better faster. I mean, the show says it all. What can we do to get people better faster? And if people know what we know, they'll do what we do. And I'm going to pass over to Dr. Jason.
No, I think it's fascinating too. And I did drop, I don't know where it populates, but what I love about our live show, unlike I think every other show in the industry, by the time our shows are produced and out and on, iTunes and Spotify and all that, it doesn't quite work this way. But if people join our live shows, they can ask questions in the comments. And I mean, how many opportunities do people get to meet world-class experts and ask them direct questions? It's the coolest part of the show. I mean, there's a lot of cool parts of the show. We get to meet great people too, but I love that part of the show. Marilyn, looks like Marilyn Wirral. I'm not sure if I'm saying her name right. Just wanted to send some accolades to Dr. Dillon as well, saying how awesome he is. But I did want to go back just a little bit to pain. And I'm going to spin it just a little bit. And I'm going to throw some stats at everybody, because everybody knows I'm a left brain, numbers, objective data guy. And I find these stats really interesting about pain, and about pain. We'll leave it there for just a minute. By 20 years old, and I'm a little over 20, but at 20 years old, approximately 37% of people are asymptomatic but have degenerative disc issues. About a little over a third, about 80% of people in their fifth decade of life have no symptoms, but pretty severe degeneration. By the time they hit 80, that grows to 96%. Almost everybody has some pretty severe disc degeneration, herniation, spinal morphological changes, degeneration, and yet they're not experiencing pain. However, I think that we all know that those degenerations can cause neurological imbalances and cause other nervous system issues, even though pain, like James was saying earlier, only 10% of the nervous system carries pain. I think it goes up you're gonna know better than me, Dr. Miller. It's been a while, but I think up the dorsal root ganglion and up substance P is released and all. I don't remember. I mean, that's all in the neurological field that I've dabbled in a little bit, but I'm not the expert by any means. But in the absence of that, people can still have neurological issues that can lead to other organ and tissue dysfunction. And that's what I'm fascinated with as a functional medicine doctor. People come to me with, I can't solve my fill in the blank, fatigue, my bloating, my hormonal, my PMS, PMDD, maybe migraines are back in there. All of these, types of visceral, I'm going to call it visceral issues or biochemical imbalances. I'm curious, can your method, and what did I labeled it as diagnostic functional nervous system muscle testing. I'm not sure what I'm going to call it. I'm just going to keep adding words to this thing, but this diagnostic functional nervous system assessment, walk me through how it's connected to the viscera, the tissues, the organ function. Walk me through that.
So every muscle in the body has an organ relationship. That's what Dr. George Goodhart started to discover. It didn't happen exactly in 1964, but this stuff has been around for a long time and it's tried and true. But he started this diagnostic muscle testing in that time. And then I'd say by the 70s sometime, they started realizing there was this organ muscle relationship even. The one that most people are familiar with, it's not exactly right, but the left side with the heart, well, the subscapularis muscle, which is your kind of arm wrestling muscle, is related to the heart. So the organ muscle relationship, that's very important. And this is important because it's the window that you're looking into the nervous system makes a difference. So whenever you change muscles, you're actually getting a different window into the nervous system, and the body's able to speak to us in a little different, from a little different angle, if that makes sense. So depending on what muscle I'm testing, I'm also evaluating some different organ functions and some neurology in that way. So again, whenever you bring the nervous system's attention to it that way, it changes how the body responds as well. So again, this is where it's not just a simple muscle test. It does matter how you ask these questions to the body. Yes, go ahead.
I'm just going to weigh in, and then James, I'll pass it right over to you. Something that I think conventional doctors can get behind even. Like, I mean, I'm talking run of the mill, your ER doc, your general practice doc, your urologist even. When people have kidney problems, their extensor muscles, the muscles in the back, right over the kidneys, they go into contraction. We talked earlier in the show about weak muscles and strong muscles, right? So these extensor muscles in the back can be used. I mean, they're used in conventional medicine as kind of a, hey, you might have a kidney issue. It might be an infection. It might be a disorder because your muscles in the back are really tight and causing maybe some pain and limited mobility. And yet I want to be crystal clear to our audience. This is conventional, medic stuff. This isn't like, oh, a smart doctor would know that. Maybe the doctors have forgotten this stuff, but this is what's taught in boards review. I had the pleasure of teaching boards review for a while. I think it made me a better doctor, in fact. But those extensor muscles are taught in conventional medicine as a diagnostic tool or a clue in their toolbox, assessing a visceral problem like a kidney disorder. So this isn't like James was saying, it's not woo-woo stuff. It's just the depth of training that you have takes it further than, oh, you've got tight low back muscles to the kidneys. It's you're basically, and I don't know, there's only 26 pairs of spinal nerves, right? And they differentiate to the muscles and to the organ systems. And James, I'm going to pass it over to you because you're chomping at the bit.
Well, you teed this up for me because
I try.
The reason they call it an organ system because it's organized, and it's organized with those 26 nerve roots. And if there's compression going on anywhere in those articulations that are segments of the spine the galasta. So what causes degeneration for such a large percentage of the population? And I'm going to answer that it's not the chiropractor, or the doctor on the show. But if we took as good as care of our teeth as we took as good a care of our spine, we'd have a much different outcome as we get older with the degeneration of our discs and our spine and the osteophytes and the way that the spine ages. So if we took as good a care of our teeth as we think we should, which we do, we've done a really great job as a culture of taking care of our teeth as a standard. You brush twice a day, you floss twice a day, and use mouthwash. Spinal hygiene or dental hygiene. But if we actually leveraged in to have people understand from a young age what it meant to have spinal hygiene, now we're turning the page forward where people have more access to their ideas of what's possible, why they should, because as Dr. Jason mentioned, the trap is set. You will get to this point where life will give you what you get because of negligence and real ignorance, because no one's actually teaching us that we should have good, healthy spines and good, healthy nervous systems. That's like a last resort. And my question to you guys, both of you, since you guys are both doctors of chiropractic, why do you suppose that chiropractic is the last resort for people that have had the botched surgeries, or they've had every pill across the script pad coming their way? Like, why do we feel like chiropractors are the last resort for any semblance of patient that comes your way?
I'm going to pass it to Dr. Miller first because I'm super opinionated on this, and I believe wholeheartedly I know why, but I want to hear Dylan.
I'm guessing that Dr. Jason and I are on the same page, but the big pharma machine doesn't want the truth to be out here. And this has been a problem for a long time, but shows like you guys are doing, and it's not just here, but there's a big movement and a big shift. Like, people are demanding answers, and it's just frustrating that the whole system's been set up this way, because people are suffering because of the way the system's set up. And, it's hard to combat that kind of money that's just constantly, I mean, when did we ever see a chiropractic advertisement on TV when we were kids growing up?
What if we had 150 of them a day?
Right.
You think people wouldn't be lined up to chiropractic offices?
Yeah, exactly.
No, you're totally right. And I'll take it like one step further. It is big pharma. It is big pharma. Absolutely. That's what's behind it. But let's go back even further in history to the 1910s with the Flexner report, right? Which we chatted about a couple times on the show. It comes up periodically. And, Flexner was hired by, Rockefeller and those folks that owned the petroleum industry and the big pharma industry. And they discovered that they could take coal tar and petroleum and create, novel chemicals that could be patented and then placed into the physiological system, the human system, and change physiology. And it came with a ton of massive side effects, deteriorating side effects, deadly side effects, a lot of complications. But they wanted to sell their product. So they hired this guy Flexner, and their question was, how can we get the medical schools to teach our way of doing this and get away from the eclectics, get away from the early, I hesitate to say osteopathy here as well, but, early osteopathy and chiropractic were very similar. Osteopathy claimed manipulation caused better blood flow to the organs. Chiropractic said no, adjustments cause better nerve flow to the organs. But really talking the same language, but getting away from the eclectics, getting away from the early advent of naturopathy schools that had kind of come together at that point, teaching a curriculum around natural healing and natural substances, dietary therapies and other lifestyles. And that was the mode at the time. And like I said, and there were also other early patent medicines. Don't forget, at the same time we had snake oil salesmen that were claiming a bunch of stuff. So Rockefeller and his guys, what Flexner told them was, you guys have all the money in the world from your oil industry, from your petroleum industry. Why don't you? I mean, literally, I don't know what the equivalent of today is, but I've heard in the trillions of dollars available to them. So they went around to all the medical schools and they literally said, we will fund you. We will build you new labs. We make you state of the art, whatever equipment you want. And the condition is you cannot teach any of that stuff anymore. You can only teach petroleum-based, coal tar-based, pharmaceuticals that are patented by our companies. And the medical schools bought it. They literally chomped at the bit for it because they all wanted that money. How many Benjamins can we get, right? So again, they chomped at the bit of this. And Rockefeller had a good question. And he said, well, what about all these doctors that are out there that know these other things? This is pre-Goodhart in 1964, right? But what about all these other doctors that know all these other things, these other natural healing solutions? And Flexner said, they're dinosaurs. They're going to die off eventually. It'll take a few generations. So here we are in 2025. We're up, what is that? Got to do math now. 115 years later since the Flexner report. And let's be really crystal clear about this. They've had over 100 years. This industry has had over 100 years to prove to us around the world, that their pharmaceutical-based approach is the most effective, the most efficient way for us to be healthy. And yet they have failed. In fact, in the United States, we are 5% of the world population, and we consume upwards of 75 to 80% of the world's pharmaceuticals in this country, more than any other country in the world. And when you compare our health and longevity to these other countries, I mean, I don't even know what the PC word is today. The old days, I would say westernized countries or industrialized countries or modernized countries. I don't know what the word is, but when you look at where we were, when I graduated with my first doctorate degree 26 years ago in a few weeks, 26 years and a few weeks ago, we were in the top 40. I think we were 32nd or so in world health and longevity, which is horrible anyway. And they just released, and by they, it's the World Health Organization, just released, the report every year. We didn't even make it. The U.S. didn't even make it into the top 40 healthiest countries at all. And yet we're consuming all those pharmaceuticals. So I would say that it's it's money and it's the pharmaceutical industry, and it's the advertising, but they co-opted the schools. What people don't understand, to quote Marcia, and I'm very passionate about this, to quote Marcia Angel, past editor of Lancet, I believe, or New England Journal. I get her mixed up. I get those two editors mixed up. She said when people are walking into a traditional, conventional medical doctor's office in the white coat, they are already being ambushed by the pharmaceutical industry. There is no chance in hell they're getting anything except a pill, a procedure, or a referral for a pill or a procedure, and that's it. People think that these medics are trained to solve these complicated cases. They're only trained in prescriptions. That's all they know. It's ridiculous. You have a drop-down diagnostic. The way AI works, guys, for everybody listening, there's a drop-down menu of a diagnostic cluster. You label it, put them in a box, and then once they're in that box, it's a drop-down menu of the drugs that are approved or the procedures that are approved, and that is as deep as your doctor's training goes, and that's it. There's nothing else. I'm done, Jim. Take over.
And you know what's not on there? Drop-down? Chiropractic services.
Yeah, it's not.
I'm going to touch on Maryland here for a minute, and then I'm going to ask Dr. Dillon another question because he's been running idle for a minute. And thank you for sharing so much information because people don't know that stuff.
Thank you for letting me rant, by the way.
and I'm going to quote the great Fred Barge. He said that chiropractors can't, no, it was Reggie Gold. If you guys want to go and sharpen your pencils and take some notes, go back and watch this segment of what Dr. Jason said about the flexion report, but also go and look at the greats of chiropractic. Go and find Fred Barge and go find Reggie Gold. Reggie Gold once was famously quoted for saying, chiropractors can't even cure a ham. And the real truth of the matter is the medical profession can't even cure a damn ham. And that's the real problem, is that the people, we've allowed the hen house is being guarded by the wolves. We have the wolves guarding the hen house, which is they sold out for a few shekels of money the future of healthy humanity, and that's where we're at today. I just want to go back and touch on what Marilyn's saying, that she said, I'm in my 60s. I believe part of the old thinking, my parents' viewpoint, chiropractors often had a bad name because many were simply bone crackers and did not have a clue about deeply applied kinesiology plays so heavily into a chiropractic visit. Can both of you guys riff on that for a minute? Let's go, Dr. Dillon.
So I wanted to back up for just a second and touch on something Dr. Jason brought up. With the medical field and literally taking information out of the medical field that was sound science. One of my really close mentors, he's a very, very smart guy, and he actually reads these textbooks and studies them, physiology books. And he's told me multiple times that the books that he had from school 40 years ago do not have the same information as they now. He's like, they literally took out some of these basic vitamin informations, like, hey, guess what? This B vitamin is for this, like literally fundamental science information that they removed from the medical textbooks that no longer exist in the medical community. I mean, that's just criminal. So these doctors, they don't get that information because they realize that you can't teach people, otherwise they'll use it and it's something other than just a pharmaceutical intervention. So I just wanted to touch on that.
I just want to touch on that and then pass it back to you for the other part of the question. But I had a friend of mine that was a medical school recruiter, and she literally told me they don't want critical thinkers. This is before the term was popular. She said they want sheep that can regurgitate information, no critical thinking. People that do really well on standardized testing. And that's all they're looking for. People that can memorize and repeat, don't think. And it frustrates me to no end, again, that we have glorified this profession because, again, of the hundreds of billions of dollars that they pour into R&D, research and development, which AKA is known as, right? Marketing. People also don't realize that when companies claim research and development, R&D for pharmaceuticals, very little of it is in research or development of the chemical. It's all in marketing that chemical to the public so that they can go ask their doctor about, whatever it is, the drug of the day. So it's so damn frustrating to me, and I'm very opinionated on it. But I will say this too. You, Dylan, you said it's criminal. I agree. I agree that it's criminal, and I call out every single prescriber that happens to hear my voice say this. They need to check themselves. They need to go look in the mirror and ask themselves what the hell they are doing, and really make sure that they understand that what they're doing comes with a consequence. The practice of modern American medicine accounts for 250,000 deaths a year at minimum, making it the third leading cause of death every single year, only after heart disease and cancer. And nobody is flipping talking about that. And it pisses me off to no end. And how many people die from chiropractic? Like, I don't even know. I don't even hear of a case. You hear anecdotally of things, but I mean, it's so freaking safe compared to walking in to the conventional medical doctor's office. Just walking in that office, you have a high chance of injury.
I want to go back to Maryland and back to this idea of chiropractors just being bone crackers. And I've made many of you that are watching this show or will watch the show in the future. I've interviewed 1,400 chiropractors in the past 8.5 years. So I have a bias, but I also have a very fundamental understanding of the healing art of chiropractic. So chiropractic is a 3-part system. It's a science, it's a philosophy, and it's an art. And what Dr. Dylan is doing is he has found himself an art, which is called applied kinesiology. And then he facilitates the adjustment as the art of chiropractic. So his diagnostic method is finding it through his method of art and science. So that's also the underlying of this is the philosophy. We believe that the body needs nothing extra in it, simply needs no interference. So now we're talking science, philosophy, and art, which I really love. But I want to get back to the heart of the matter with the bone crackers idea. Really, there's a division in thought. And when people have been bought as a culture to believe one dogmatic approach, they're going to bag on the other because it's not popular to think the other way. And that's just something I just wanted to clear completely from what we've been discussing today, that if people saw 150 chiropractic commercials every day, we'd have the most thriving world out there that wouldn't be sick, and they wouldn't be dysfunctional, and they wouldn't have musculoskeletal issues. Their innate intelligence would be on. If you guys don't know what an innate intelligence is, I'm just going to give you a quick synopsis of that. If I cut my finger, I don't have to look at it and tell it to heal. It heals naturally because innate intelligence is on the job. That's the God inside of us. It's always going to heal our body to the best of adaptability. So I know we talk about some big stuff on the show, but I think it's also good to give people a fundamental platform to understand what we're talking about and why it matters. But I want to go back to you, Dr. Miller. I want to talk about a case that you've had, like a dramatic transformation where somebody that was pitched into the field and they got 5 doctors coming at them and telling them to do these 5 different things. Then they come to you. Talk about a dramatic patient transformation that you've witnessed doing your approach, that now we can speak to our audience that are all fired up, listen to what we're talking about.
Sure. Let me just start with a simple case of pain. I remember having a guy, this has been probably 7 or 8 years ago now. He was just telling me, he came in for his back issue, but he incidentally told me that he had this pain on his hip where he got kicked from a horse 30 years ago. And it's been tender to the touch ever since. And I think I did it because whenever I was having him move around, he said, oh, I can't lay on that hip. And I asked him why. Well, it has that deep bone bruise and it should have been healed years and years ago, but it's still there. So I went through and we brought that back to the nervous system's attention, because here's this withdrawal reflex. So like I talked about right at the very beginning, stepping on a nail and even your arms pull up. Well, if that memory is still stuck on all the time and the body's constantly pulling back, we brought the brain's attention back to that old injury, reset it, did a few methods, some tapping, and he was just beside himself. He could touch his leg for the first time in 30 years. And that's just one example. Pain's a real easy one for people to understand. And that was tender to the touch, so much so he couldn't hardly touch it at all. And then he could rub it, touch it, and it was just an amazing transformation. And I'll never forget that because I don't get a lot of horse kicks.
Yeah, I think it's really cool for people to hear these things, because we're taking the curtain off of the natural healing world right now. And we're giving people a chance to see behind the curtain as what two great minds have dedicated their life's work to. And the whole idea of both of you sharing testimony of the work that you love and the passion that you have for the chiropractic profession. Like I was saying earlier, Dr. Dillon, before we went live, I don't get a chance to talk to many chiropractors on the show. So knowing that you were coming onto the show, I was like, we're going to just swing and swing and swing, because I want to see the world understand what chiropractic profession really is. And it's not anecdotal. It's very, very, I don't even like the phraseology of evidence-based, but we get people better. And there's no explanation of it other than we took the pressure off the nerve, allowing the body to heal the way it's supposed to naturally, which is fascinating to me. And if the world was as fascinated about chiropractic as I was, we'd have a whole different world that we all live in today, where we'd all be going first to the chiropractor before anything else, before we'd even pick up a pill and throw it into our mouth. Go ahead, Dr. Jason.
No, man, I totally hear you on that. And I think one word that we don't bring up a lot, we don't get an opportunity. So thank you, Dr. Miller, again, for this opportunity, is vitalism. And, chiropractic is possibly, I'd have to think about it, but the last vitalistic profession on the planet. There have been others. We mentioned old school osteopathy. Let me explain what vitalism is. James said it very clearly that, our bodies know how to heal. And I will say, maybe even more clearly, the power that made the body heals the body, right? Innate intelligence is part of a triune of intelligence, where we have the universal intelligence. Some people might call that the source or God, or Holy Spirit, or whatever that is, but the big thing. And that's distilled into each one of us and into our cells again, as we started talking about, and into our DNA at the beginning of the show. That's the innate intelligence. Our bodies know what to do. The third one is educated. That's what we learn while we're here. And we get sick when our educated and our innate get misaligned. And it's usually the educated that's the problem. It's always the educated that's the problem. But I want to go back to this idea of vitalism, because chiropractic is unique so far in that it has rejected opportunities to prescribe drugs and do surgery. I will say osteopathy, we mentioned that, Andrew Taylor Still, that osteopathy predates chiropractic a little bit, a decade or so. Blood flow versus nerve flow. But the early osteopaths, they call it manipulation, but they were moving people around and getting that nerve flow, the blood flow working. And then in the 60s, they were offered, so was chiropractic, the opportunity to prescribe drugs and do surgery and be, quote, real doctors, right? And again, we got to remember that we're now about 50 years after the Flexner report, where all the schools are not doing well unless you're a funded medical school by the big pharma companies. So osteopathy took that bait. They took it right away. And now we can't even tell the difference between DOs and MDs. They're the same thing. We used to have other ideas of patient-centered practices. Nurse practitioners, they're kind of new to the game, but they were very patient-centered. And I have friends that are all sorts of practitioners, so I know I'm probably offending them as well, and I love y'all. But the reality is, nurse practitioners, man, they write more scripts than medical doctors and DOs. They have to prove themselves so much. Like, look, I can write a script. I'm the real deal. We've got naturopaths. One of my other doctorate degrees. We've got naturopaths that they just want to write prescription drugs. That's all they want. They fight for the prescription rights, again, because they want to be legitimized, because they've bought in to this whole idea that we don't need to be vitalistic anymore. We can be mechanistic. We can buy into that dogma of pharmaceuticals heal people, which we all know they don't. We're the sickest country on the planet, like I said. So chiropractic is unique in its vitalism. And I'm coming to a question with this because I'm impressed with chiropractic holding its ground. We do have some, I almost labeled, we do have some people in the profession in certain states in chiropractic that are pushing for script rights right now. And the reality is they're probably going to get it because Big Pharma wants more script writers. It's not Big Pharma that's fighting that. It's other script writers in the states that don't want those chiropractors to be doing that because they don't want the competition. Same thing they fought when nurse practitioners asked for it. They don't want the competition, but nurse practitioners got it. Just wait. It's coming. I don't know what's going to happen to this profession of chiropractic. I genuinely don't know. Here's the question. When we opened up the show, I mentioned that you combine faith, science, and the nervous system working together in a medical landscape that often separates these things. How do you integrate faith, science, and the nervous system together, and what role does that integration play in the healing process?
Well, thank you for that. And that's, you kind of touched on that a minute ago. You're talking about the innate, whatever that is that causes healing. And, I'm not against medicine whatsoever. I'm not against the medical field. They have their place, but it's completely reversed. It should be do the most conservative things first. Then you have that medical field for the emergencies and for the things that truly need it. Like, I'm absolutely not against the medicine field. And, a lot of people think whenever you speak against it, it's like blasphemy, but that's not the case at all. Medicine doesn't heal people. I don't heal people. The body heals itself, even whenever you have surgery and they, put rods in, the rods didn't heal anything. The rods held things in place while the nervous system healed itself and, grew back together. And whenever I'm working on a patient, I'm just trying to be a conduit for healing to happen. I'm not a healer. So, whenever I'm trying to add faith to this, I think God put all these, the Lord put all these things in place for the body to heal itself. And just like James said, the finger gets cut, it heals itself. You don't have to think about it. Well, much of the nervous system is that way. And the way that I integrate that for me, I feel like Holy Spirit trying to speak to me through muscle testing a lot of times. And if and when I feel like healing prayer shows up while I'm working on somebody, I ask someone if they would like me to do prayer with them, and I'll go through and I'll muscle test different common hindrances to healing even, and we'll do a prayer over that if something muscle tests that way even. That's a little unconventional even in my world, but that's a big aspect of healing, and most people don't get prayer together. In the Bible it says, lay your hands on people, pray together, and anywhere two or more gather in my name, there I'll be. Amen. So our words have a lot of power, and people don't realize that. People, curse each other and they don't even realize it. But if you can use your words out loud, and it makes a big difference. So in the Bible, Jesus used a lot of commanding prayers. Very seldom did he say, "Oh, please help me." He said, get up and walk. Open your hand. So there's commanding prayers and, a lot of different ways to pray, but I try to integrate that, and it's very powerful. And that's where I don't know if that completely answers your question, but I try to integrate that within treatments if and when it's appropriate, and only when people want it. I would never just pray for somebody. That's not appropriate.
Well, I want to jump in because I'm very interested, because we're talking about this whole medical arena. And I think chiropractic is a standalone profession. I don't think chiropractic is in the medical profession. I think chiropractic is chiropractic. And I'll always believe that. And as an advocate of 17 years, like Dr. Jason said, they're clawing at chiropractic and trying to get them to become more like them. But in all respect, chiropractic is a standalone profession. And that's what I love about this profession. It doesn't need what everybody else is doing. And if it did, it wouldn't be chiropractic. So the ground is set there. But I'm sure there's a lot of people out there that are hemming and hawing right now listening to us. And they're like, well, I'm curious, like they're talking about all these things, but is it covered by my insurance? And that's a real rational question. And is the stuff that you do, Dr. Miller, is that covered under insurance, or do people have to come out of pocket for this? Because I believe as the future goes on, we're going to become more out of pocket for everything. And I look at the insurance bubble about to collapse.
Yeah, I would agree with that. Dr. Jason, did you want to go first?
No, I was just going to say me too. I see the industry collapsing. I think that we've been, again, bought and sold a little bit of, boy, I'm just fiery today, everybody. I love you guys for the seconds here that I'm chatting. But again, we've been led to believe that the solution that we're looking for our health is within the insurance system. But don't forget, they only pay for the most part, they pay for drugs and procedures. And I mean, chiropractic is generally covered. There are some folks that work within the system and some folks that work outside the system. But I think that whole industry is collapsing, and I'm curious to see what happens with the Affordable Care Act and the subsidies going away. And now they're talking about, creating a HSA for every tax-paying American that we can use, however we want to use it. I don't know listen, I'm not a politician. I don't know how to fix that stuff. But I'm curious. I mean, it's collapsing in front of our own eyes. I will say, just very briefly, for anyone that wants to watch the sellout of medicine to the insurance companies and big pharma and the hospital, watch a documentary called Escape Fire. And I'm just going to say that there were many presidents that led to this, but it was the pen from Obama that signed that deal. And he ran on the ticket that he would not do that. And boy, he did it. So watch that documentary. Don't trust me, Escape Fire. But Dylan, I'm turning it over to you, man.
Yeah. Insurance, they in general will just cover an adjustment from a chiropractor, and they'll do, 3 or 4 regions. And I've always been frustrated with how the insurance system was set up. And I feel like they really limit, which I think that's another way they've tried to control chiropractic is by what they'll pay for. And you talked about bone cracking early on, and just trying to devalue what the chiropractic adjustment is actually worth. What I do, what I try to do is spend a lot of time with patients. I never wanted to sell out, so I charge the patient cash. I have them pay, or cash, check, card, whatever. But I have the patient pay for that visit, and I try to add a lot of value. Where I'm located, it's the smallest and poorest county in Missouri. And so I've tried to add a lot of value and still be able to charge a fair cash price. And that has always been what I tried to do, just provide above and beyond. And that keeps me pushing and trying to learn new things and more things and faster ways to get people better, get better faster.
Question for both you guys. In Dr. Jason's introduction, you guys can go rewind back to the beginning. One of the phraseologies he had in there was practitioners would tell patients that it's all in their head. Why would somebody that is a physician ever give that as a walk away? Like, it's just all in your head, bro.
Man,
have you guys seen that happen before, where a patient will come in and somebody's like, it's just all in your head?
Yeah, absolutely. And boy, the worst thing you can do, which is another criminal thing, is steal hope from somebody. And I think it's just poor training, poor bedside manner. You should never, ever do that. And that was like something all the way through COVID that was just so frustrating. Like the difference, that's just the placebo effect alone, 30% negative swing right there. Like, instead of telling people on the news, like, hey, things are going to be fine, it's going to be okay, they went the complete other way because of the agenda they were trying to push, told them that they were going to, be terribly sick. And, that's a 60% difference between telling people that it's okay versus it's going to be really, really bad. And, that is just criminal in itself. You never steal hope.
So I agree. And again, we're seeing data coming out now that the PCR testing was so flawed that possibly only about, I think what the last numbers I saw was 16% of the cases that tested positive actually had COVID out of all of those people. And it mostly looks like it was other upper respiratory viruses and pneumonias and things that, fell off the charts when we were testing for COVID. And I don't know if you guys saw, but the UK HSA, their health services agency in the UK, in the Telegraph, the London Telegraph, huge, moderate newspaper right down the middle, like it's like the New York Times over there. They said after their interview with the UK HSA that the data is so damning. Basically, I don't think they used that word, but it's so upsetting that they can't release the numbers to the public because it would cause too much upset and uproar with the general population. I mean, it's coming out that, like you said, I mean, there was a lot of fear tactics in there. And again, the agenda was control the population and profit from it. And go ahead, Jim.
Well, there's never been a show like this before. And I value both of my positions, being on here with two doctors, like talking about topics that the general population isn't going to get from the box God, which I call the television. They're not going to get that from anybody. That's why we've been hard on the line right now to produce this show and to give people resources to real truth in journalism. Dr. Bradley's got his degree in journalism and media framing. I got my degree in multimedia graphic communication with emphasis in marketing and journalism. So we both are real professionals that do this type of work. And it's such an honor to be able to, expose real truth to people, because they're not going to get it from other sources. The other sources are hiding it and they're clawing it back and they're keeping it away from exposing it, where we're here saying, look, this is why it is the way that it is. It's the Flexner report. It's the Rockefeller stuff. It's the big pharma inclusion, and there's no money in healthy people, guys. And I that's what this show is all about. There's no money in healthy people, and chiropractic is the last standing piece on the chessboard that stands for medical freedom, family health freedom, and those types of quality of life quotients. Nobody else is doing this stuff. But I know we got about 15 minutes left of the show, and I'm going to pass it over to you, Dr. Jason, here in a brief second. But I want to talk about the bombshell, the elephant in the room nobody's talking about, and that's the word autism. And I know you probably are getting cases into your office, Dr. Dillon, that they're told it's all in their head. They don't know where to go, who to trust. They're at the end of the line, and they're coming to you now. How are you helping people with the autism?
Yeah, that's a big topic. And, it always comes back to the same thing over and over. I work on the basics. That's first and foremost. And their nervous systems can get better. That's the thing. Like, it's amazing what the body can do. And I had one specific case of autism, fairly severe, but I could get this patient to actually point towards the ceiling, just hold a finger up towards the ceiling. And they were laying on their back, of course, and she could understand that enough that I could get a muscle to test. And that was what I needed, was just a way into the nervous system to start evaluating. And they said that after, I think we did, I want to say 6 visits, probably each a week apart. And it was life-changing. She was able to sleep better, quit bumping into things, because the coordination got so much better. It's been a while now. I've forgotten a lot of the very specific details, but it was amazing. There was just all kinds of emotional differences and not as many outbursts. And this is a pretty severe case, and it was just really amazing. But again, basics, getting those basic neurologic functions set back into place made a huge difference.
Well, before we pass it back over to Dr. Jason, I just want you to once again tell the audience where they can find a qualified practitioner that does what you do.
Sure. You can go to the ICAKUSA.com, and there's a Find the Practitioner tab there. And it'll have a map, and you can type in a zip code and look for people in your area or near you. We're few and far between, but there's lots of us there ready to help any chance that we can. So
cool thing that there's airplanes.
Yeah, exactly right.
No, and I appreciate that. Yeah, I appreciate it too. And just for everybody trying to write that down, it's the International College of Applied Kinesiology, USA. And we'll put all of that in the show notes. And then also, I know a lot of you guys that are listening are going to want to connect with Dr. Miller specifically. I mean, he's the expert. He's the guy. He's the guru. And, we'll make sure that we have his contact info in the show notes as well. So go over to the website and hit the show, and all that stuff will be there, all those links. I wanted to come back to answer your question, James. And I know I'm a question behind now, and it's probably the last thing I can comment on, because you're getting short on time, I guess, or I was going to try to use a colloquialism there, but it didn't work. But anyway, we're getting a little short on time. But I want to come back to it's all in your head, because there's a difference between it's all in your head and I'm going to use a bad word here, psychosomatic, right? I mean, psychosomatic means that it might originate here, but then manifest into the physical body. And what I mean by that is there can be real physical manifestations of stress, of a stress response. I mean, we've talked on the show before about the book, The Body Keeps Score. I mean, there's a number of people that are documenting, scientists and clinicians that are documenting the stress response. I mean, going back to, Hans Selye, back when we coined the term stress, I mean, he got his Nobel Prize. He was a physicist and a medical doctor. And when he coined the term stress, and as we think about stress today as, like, oh, I'm so stressed, I'm having a stressful day. Selye meant it as the breaking point, the stress. Think about like a physics, like breaking something. It's the breaking point. How much stress can you handle, right? And stress breaks the body. It doesn't just break our emotions. Stress has a cascading effect, and we've talked about this, with a couple of hormone folks that we've had on the show. But when we have stress, we can't make our regenerative hormones. I mean, we're making stress hormones and stress neurotransmitters instead of feel-good neurotransmitters and feel-good hormones and restorative hormones, because we only have so much of the substrate to make the product. And if we're making a bunch of product that is stress, we can't make the healing parts as well. So I just want to be careful when we say doctors that say it's all in your head, they're not nuanced. Most of them are not nuanced enough to say stress is a contributing factor. What they're saying is it's not real. And there's a big difference between it's not real and you're under an amount of stress and duress that is relentless and not going away. And it has caused a chemical cascade in your body. It has caused, whether it's a thoughts that you're having, chemical imbalances or trauma to your system, to your physical body. Those types of stress, the 3 T's, trauma, toxins, and thoughts, right? Those 3 T's can lead to real manifestations in our body. It's not all in your head, but stress is a big player. And so I guess I have time for one more question, and this is it, Dr. Dillon. Maybe I'll have time for 2. We'll see how we manage the time. But Dr. Dillon, I see stress as the ultimate equalizer with the most complex clients that I see, and I'm sure you do too, but I see clients that fall through the cracks. I see people that have really complicated multifactorial issues going on with every system, as Jim talked about, organizational system, every organ system involved, because they're all interrelated, right? But I see stress as the ultimate equalizer. And I've started working on, implementing stress work. I don't know if that's the word I'm looking for, but ways to regulate that nervous system. And again, with every client that I'm working with at this point. And I find that people that listen to me and don't think that it's woo-woo to, breathe a few times a day and have some structured breath or some other, things, they do get better faster. Dylan, I would love to hear you chat about the role of stress neurologically in the breakdown of the human system, and what can we do to take a hold of that?
So I think, the thing with stress is it's cumulative, and we don't know. Each person is individually so much different. So we don't know where your breaking point is, but after a certain amount of stress, whether it's environmental stress, emotional stress, physical stress, it accumulates. And you talked about having that breaking point, where that breaks over, and it's like your body can only handle so much. So anything you can do to eliminate some of those stressors, you bring that threshold down. And then guess what? If you do come down with a cold, it's not the cold that broke that person. It was the accumulation of stressors that they just couldn't handle anymore. Well, if your threshold's way down because you've eliminated all the chemicals out of your diet and you're exercising and you're doing those stress meditations that you talked about, and you're going and getting regular treatments to your nervous system and doing these natural things, your threshold is down. So I think that's really important, just doing as many things as you can to naturally bring that threshold down, because there's a lot of people, we're bombarded constantly with the, media and that stimulation. Well, that by itself probably isn't too big of a deal, but it's just this accumulation of so many different stressors that puts people at that threshold just ready to snap. And I can speak to that a little more, but James, did you have something to?
I just know that we're coming to the edge of our show today. But I do know that you're finishing up your first book. I think it would be very important for us to at least touch on the book, the premise of the book, and potentially release date.
So I took it through editing once already, and I've still got quite a bit of work to do to make it good. I could have the book out right now, but I want to make it good, and I need to add quite a bit more touches to it. And it's just a matter of putting more time in and really buckling down. As you know, it just takes a lot of effort and time. It's going to be on diagnostic muscle testing. I'm going to try to relate it and in understandable terms for the average person out there that's looking for answers. And that's my goal. It's going to be a little bit, because it's just, I'm hoping over the winter time I can put a lot more focus on that. But I don't want to give away too much information on it yet, because it's just not quite there. But I hope to have it done sooner than later.
Well, if you need a good publisher, I know a good guy for you.
I'll keep that in mind, and I appreciate that.
Well, Dr. Jason, do you have any closing comments or statements or questions even for Dr. Dillon today?
I have one question and one comment, and maybe I missed it, and I'm sorry, but what's the name of the book?
It's going to be The Muscle Method.
The Muscle Method. Thank you. I'm excited to read that. And, my other comment about myself is maybe I needed a couple more editings through my first book. But it's like giving birth, man. I mean, James just finished his first book. Is it The Best Day of My Life?
Best Day of Your Life.
Best Day of Your Life. That's right. And when's that coming out?
Well, I'm in the exact same structure as Dr. Miller here. I'm reading through chapters, I'm editing, I'm working through it, and just trying to make the best production possible, because I want people to have something really amazing that they can learn from and give themselves the best day of their life every day. Who wouldn't want that?
I love that. I love that. And I'm on chapter 5 of my second book, and I've been on chapter 5, as James knows, for, I don't know, like 6 months now. I'm hoping that over the winter I can finish that up and, get mine out. Mine's Carnivore Consciousness, and I'm excited about that. Also, Kim Stark had a great question. She said, Dylan, I'd like to pre-order. I think, a lot of people would like to do that. And also, by the time the show gets produced and is out, Dylan's book might be out as well, but we'll have the link to purchase that book on the show notes as well, or to pre-order, depending on the timing of everything. So, thank you. And I just want to say thank you again, Dr. Miller, for coming in today and sharing, these pearls of wisdom, giving people hope, helping them understand that there's a whole methodology out there that's beyond, imaging and testing and all of that goes into that. There's a whole lot more out there than just, pills, potions, and lotions. And I'm excited to see, where your path goes. I'd love to pre-invite you on when that book comes out, and we'll just dissect that book like crazy. I think that'd be a lot of fun. So we'll have you on for part 2 coming up probably sometime, first or second quarter next year. So that's exciting, my friend. Thanks for coming on today.
Yeah, thank you guys. I really appreciate the opportunity, and it's nice to get to know you guys better. And just thanks for what you're doing here. I think it's great, and just keep grinding. That's all you can do.
Well, I wanted to tee up the last question for you. Is there anything we didn't ask you that you wanted to share with our audience today?
I don't know if there's anything that specifically burning that you didn't ask me. I think it would be pretty interesting, and I've always kind of had this in my heart to pray for people. And if you guys would want to entertain that, I would be happy to pray with you and your viewers.
Please do it.
Okay. And the interesting part with healing prayer, biblically speaking, the Lord likes to heal people. He uses that to build his kingdom. And anyways, an act of faith has a lot of power. So, Father, in the name of Jesus, Holy Spirit, come in power and just bless these viewers. Bless James and his family. Bless Jason and his wife, Rachel. Bless this podcast and let it touch hearts and change lives. And Holy Spirit, in the name of Jesus, I command any and all and bind up any and all things that aren't from you, Lord, any affliction, infirmity, and oppression to leave right now and be placed at the feet of Jesus. And Holy Spirit, close any doors of access, heal any inner hurts and open wounds, and bless these people in Jesus' name. Amen.
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 Thank you.
Yeah.
Well, Dr. Miller, this has been absolutely mind expanding and paradigm shifting, and the prayers an extra something that we thank you for. For our listeners, if you've been struggling with chronic health issues that no one seems to be able to explain, if lab tests keep coming back normal, but you know something's wrong, or if you've just tried, you're tired of treating symptoms without ever getting to the root cause, Dr. Miller's approach to diagnostic muscle testing offers a functional window into your nervous system that could finally give you the answers that you've been searching for. When he was talking earlier, he was talking about the autistic patient, and chiropractic is like that one key that goes into the nervous system and turns it and opens up that new door and that new possibility for people. So what we're talking about today, this isn't about masking symptoms. This is about listening to what your body's actually trying to tell you and working with its innate intelligence to facilitate real, lasting healing. And remember, anybody watching this, nobody's coming to save you, but solutions like this prove you can save yourself. Dr. Miller, thank you again for sharing your wisdom and your mission with us today. And to all of you, our Get Better Faster Nation, thank you for listening and for your continued support. You know, the best way to show your support is share this episode with somebody who needs to hear this message. If you guys were on today and you found some value in this, please share the show. Share this with somebody that's suffering out there that needs support. Go to the Facebook, click that link, copy it, send it to 5 people that need this message today. And don't forget to subscribe to all of our channels so you never miss another episode of the Get Better Faster podcast and get all the behind the scenes hijinks we've got coming your way. We've got more incredible guests lined up who are going to blow your mind with real solutions for reclaiming your health, your happiness, and your life. Until next time, keep questioning everything and keep getting better faster. Dr. Miller, Dr. Jason, thank you so much today.
Thanks, James. Thanks, Dr. Miller.
Thank you, guys.
Really appreciate the prayer.
Absolutely. Anytime.
All right. Bye.
Love y'all.
Thanks for tuning into the Get Better Faster podcast. Join the movement and visit getbetterfasterpodcast.com to find all our episodes, micro content, and resources to help you and your family get better faster.